And my first question is to Mr. Stewart. Mr. Stewart, how is PHAC keeping track of vaccinations given across Canada? Is there a national database that's recording first dose, second dose? There may come a time when Canadians may want to travel and they may need to produce proof of vaccination. I won't call it an immunity passport, of course, but uh, how is PHAC looking at that particular data set?
That's an excellent question. And we're very much looking at this idea of some kind of vaccination certification documentation. As people are immunized, it'll be increasingly needed. So it's a great point. As you know, it has been discussed here today, provinces and territories are the ones administering the vaccination on the ground. And each of them have a documentation system for tracking who was immunized and tracking who needs a second dose. And then what we've been doing with them is creating a sharing of that data. And that data, as it comes into us, we have been putting up on our website. And when it comes to negative aspects, for instance, an adverse effect, there's a well-established network to communicate as quickly as possible that something has occurred. Fortunately, so far, there have been very few instances of problems. So there is a well-developed system in place, and through the National Operations Center, we're make that information transparent to each of the jurisdictions participating in the campaign.
Thank you. And now, Minister Hajdu, it's been quite a year for you. And personally, I would like to simply say thank you for all your answers here today, for what you've done over the last year, remaining calm and thoughtful, and responding to so many different questions. But obviously, over the last year, there have been lessons learned. And I wonder if you could kind of summarize for us uh, as we go beyond the pandemic and applying some of the lessons that you've learned as Minister of Health. Uh, are there areas where you can see within the ministry, within the many agencies that relate to the ministry, where there's need for improved staffing, areas where we could have benefited perhaps from increased data? Anything that you've learned that will be put to good use going forward?
Thank you very much for the kind words. And yes, we are actually conducting a lessons learned broader review, as you know, in terms of the entire pandemic process. I will just say personally, and I've said this before publicly, so it won't come as a surprise to any of my colleagues, but someone who worked in public health for 9 years prior to politics with the Thunder Bay District Health Unit, and I know MP Jacek, that you were also a Minister of Health at the provincial level. Public health, that is the things that we've all come to know now: contact tracing, protection, prevention, promotion, is often dramatically under recognized as critically important to the health of a community. We spend a lot of money on physical delivery of health, healthcare systems, hospitals, doctors, all of the kinds of stuff that we think of when we see health. But public health typically, if lucky, might get 2% of a healthcare budget in any province or territory, maybe a bit more, maybe a bit less. And it plays a pivotal role in protecting the health of citizens. And I would say at the federal level, we are looking now at ways that we can ensure that the Public Health Agency of Canada has a robust footprint here within the family of departments and agencies, because that prevention and protection role that public health has played for centuries is incredibly important.
And just very quickly, you mentioned contact tracing as a key element of prevention and public health practice. The federal government has assisted provinces with personnel able to help with contact tracing. Could you just quickly tell us what that has consisted of?
Absolutely. We've assisted provinces and territories not only with contact tracing through, for example, trained contact tracers at Statistics Canada, but we've also assisted them with many other supports to deliver healthcare. in their response according to their responsibilities. So Red Cross supports in long-term care homes, epidemiological and other research expertise. I see the red flag, but we've been there for provinces and territories, not just with the Safe Restart 19 billion, but actually tangible supports in communities that are experiencing significant crises.